My name is William Harrop Griffiths. Welcome to 21 Portland Place, the headquarters of the Association of Anaesthetists of Great Britain and Ireland, the AAGBI. And I'm here today talking to Dr. Nigel Harper, a consultant anaesthetist at the Central Manchester University Hospital's NHS Foundation Trust. Dr. Harper is, as I said, a consultant anaesthetist, but he's also one of the country's leading experts on allergy in anaesthesia. Nigel, hello.
Hello, thank you very much for inviting me.
Dr. Harper, what is anaphylaxis?
Anaphylaxis is an extreme form of allergy. Most people are aware of what allergies are, and in anaphylaxis the response is much more severe, which can cause a very low blood pressure or difficulty in breathing.
Are you actually saying that anaphylaxis can kill you?
Anaphylaxis can indeed be fatal, and many people will be aware of the unfortunate cases where anaphylaxis to foods such as peanuts has caused loss of life.
Just how common is this form of allergy? What are my chances of suffering anaphylaxis if I go and have an operation?
During anaesthesia, anaphylaxis is thankfully extremely rare, and most anaesthetists would only expect to see 1 or 2 cases during their entire working lifetime. But of course, when it does occur, it can be life-threatening.
The number of people with allergies in this country, in most developed countries, appears to be increasing. Does this mean that anaphylaxis, anaesthetic allergy, is becoming more common?
We do know that there are several deaths from anaphylaxis during anaesthesia each year in the UK. Of course, it is important to remember that during anaesthesia, patients receive drugs not only to keep them asleep and pain-free, but also other drugs which are important during the process of surgery, for example antibiotics. And we do know that anaphylaxis to antibiotics is on the increase in the general population.
Does this sort of allergy run in families?
Considering anaphylaxis during anaesthesia, patients can be reassured that if a family member has suffered this severe allergy during a surgical operation, that they are themselves at no greater risk than any other member of the population.
But what about if I've already got a lot of allergies? If I'm somebody who has multiple allergies, am I more likely to suffer from anaesthetic anaphylaxis?
Many people ask me this question. It's highly unlikely that there is a strong association between allergy to one drug and an allergy to another drug.
What are the medicines that most commonly cause anaphylaxis?
Of course, these severe allergies during anaesthesia are extremely rare, but the group of drugs which is associated more commonly with this phenomenon is the group of drugs known as muscle relaxant drugs. These drugs are given only when the patient is unconscious during anaesthesia to facilitate relaxation of the muscles. And of course, their action is reversed with an antidote before the patient is allowed to regain consciousness at the end of the anaesthetic process. Not all anaesthetics require these muscle relaxant drugs, probably only about 20%.
Am I right in thinking that these muscle relaxant drugs would only be given in association with a general anaesthetic?
Yes, indeed.
Does this mean that from the point of view of anaesthetic anaphylaxis, it's safer to have a procedure done under a local anaesthetic than under a general anaesthetic?
Allergy to local anaesthetics is extremely rare. In fact, most reported cases of allergy to local anaesthetics are the result of absorption into the body of adrenaline, which is often mixed with local anaesthetics, particularly for dental treatment.
Dr. Harper, are all anaesthetists in this country taught how to recognise anaphylaxis and how to treat it appropriately?
The first thing to say, Will, is that all anaesthetists in this country are medically qualified, and they undergo a very prolonged and rigorous training after qualification before becoming anaesthetists. As part of that training, anaesthetists are taught how to deal with and how to avoid, indeed, adverse reactions during anaesthesia, and of course anaphylaxis is one of these. The reason for introducing these new guidelines is to keep anaesthetists up to date with improvements in diagnosis and treatment of anaphylaxis, which of course occur over a period of time.
What should members of the public do if they have allergies and they're scheduled for surgery and they're really very worried about the risk of them getting anaphylaxis or severe allergy during an operation or an anaesthetic?
One of the most important advances in recent years in anaesthesia has been the advent of preoperative assessment clinics, where patients are seen in consultant-led clinics by an anaesthetist or by a specially trained nurse in advance of surgery. And this, of course, is very important in identifying issues which may reflect the safety of anaesthesia. This is the place where problems which may occur can be circumvented. And this applies to anaesthesia, allergy, more than probably any other situation. So it's important that if a person's coming up to surgery, when they attend one of these clinics, they discuss the allergies they may have or they think they may have with the anaesthetist involved. That helps the process of planning the anaesthetic so that risk can be avoided. There are, of course, many different alternative anaesthetic drugs, and most anaesthetics comprise not 1 or 2 drugs, but 7 or 8 drugs, in fact.
Dr. Harper, once a patient has suffered from a severe allergy like this, what happens next for that patient? How do we find out exactly what drugs or what fluids caused the anaphylaxis?
It's very important to try to identify the particular cause of this severe allergic reaction. As I mentioned, patients receive a large number of drugs during surgical procedures, and they're exposed to a relatively large number of allergens. As a result of which, investigation of these events is complex and requires considerable expertise. There are in the UK a number of clinics where patients are seen by allergists, clinical immunologists and anaesthetists with a special interest in allergy to try to identify the cause of these reactions.
In your opinion, are there sufficient facilities and clinics to be able to investigate all the patients who suffer from anaphylaxis adequately?
Patients often have to travel quite a long distance to a specialist clinic currently, and of course it's important that we do try to reduce the waiting time for patients as much as possible, especially if surgery has had to be postponed because of one of these allergic reactions and the patient is now waiting for surgery. Both the House of Commons and the House of Lords have recently produced reports indicating that allergy services do need more support in the UK. And the Royal Colleges and other professional organisations are working hard to improve the provision of these services, and of course greater funding will be needed appropriately.
Finally, Dr. Harper, what advice would you have for a patient if they are scheduled for surgery and have worries about allergy?
Allergies which cause problems during anaesthesia are fortunately very, very uncommon indeed. But if patients have concerns, they will be able to talk to the anaesthetist in advance of surgery. If a patient's being admitted on the day of surgery, they will have ample opportunity to speak to the anaesthetist before leaving the ward to go to the operating theatre. This is routine practice now. If surgery is being planned several weeks in advance, then it's usual for patients to attend a preoperative assessment clinic, and this is the time to discuss allergies with the anaesthetist.
Dr. Harper, thank you very much indeed. Copies of the Association of Anaesthetists of Great Britain and Ireland's latest guidelines on suspected anaphylactic reactions associated with anaesthesia are available for download from its website, www.aagbi.org.